Today I'm going to answer a question that we get from a lot of patients, and that is the pros and cons of breast implants versus fat grafts. So I'm going to tell you some things that a lot of plastic surgeons probably wouldn't tell you. With breast implants, it's pretty basic. You pick the size, what you see is what you get, and they're going to last you a long time and stay stable. With fat grafting, if you take out this much fat, then you purify it down to here, and then this much is going to survive. So what does that mean for breasts? Well, when you fat graft a breast, it can look pretty good for the first few months, but a year or two later, it's going to shrink and get a lot smaller. So what might look like a 2-cup size increase right after surgery, a year or two later is going to be like a 1/2 cup size. So what does that mean? Well, patients keep coming back and they get more and more fat grafts, and some patients have to have 4 to 6 fat grafting sessions to get the size they want. Other things they may not tell you is some of the fat does not survive and it dies, and it forms what's called fat necrosis, which can make the breast kind of lumpy. The other thing, sometimes even though we try to purify the fat, there are some oils in there that get injected as well. Oil's part of your body, but what it is ruptured fat cells that have leached out the oils, and they can form cysts. Now the other problem with the dead fat in there is that it can calcify, and then on mammogram sometimes a radiologist might have a hard time saying, is that a breast cancer or is that dead fat from the fat grafting that she got years ago? So all these things need to be taken into consideration, and talk to your surgeon in great detail before you decide fat graft versus breast implants.